Thank you, sir. Sir, I'm very proud to be part of a government that puts the health and the well-being of every South Australian as one of the core reasons for the work that we do. One of the key aspects of our government's record is an improvement and enhancement of our healthcare system here in South Australia, a reinvestment in services in institutions such as the Modbury Hospital, the Lyle McEwen Hospital, the Queen Elizabeth Hospital, ensuring that our health system is operating as well as it possibly can be. The revitalisation of the Repat Hospital, the incredibly strong body of work in the Southern Adelaide Local Health Network, the transformation of the health governance by having local boards with a far stronger capacity to ensure that the needs of local communities in South Australia are supported for the needs of their area. The Minister for Health, Stephen Wade, has done a remarkably strong job over the last 3 years in turning around the legacy of dysfunction and disrepair left by the Labor Party after 16 years in government. Health Minister after Health Minister, finally with the now Leader of the Opposition, that tenure of transforming health overseen when the current Shadow Health Minister was, I think, Chief of Staff, certainly a senior advisor to former Minister Hill and Snelling. The disrepair in which the Liberal Party, when we came to government in March 2018, found in the health system was very poor, very disappointing, not unexpected, but potentially even worse than we had feared. It was a financial and organisational mess. In 2012, the former Labor government was presented with a report, indeed, that laid out the appalling state of the Central Health Network's budget, but did nothing. 16 years of Labor's mismanagement, our Central Health Network, which I think is at the centre of the motion before the House now, needed to refocus and rein in. In 2018, on coming to government, we launched a responsible roadmap back to stability and excellence. Cordamentha's diagnostic review in 2018 identified that CALHN, the Central Adelaide Local Health Network, was suffering from a lack of financial control and reliable information, poor processes and, indeed, a poor culture. It confirmed the extent of dysfunction in performance monitoring, procurement, planning, improvement capability and risk management. It described an organisation lacking in clear motivating vision or sense of purpose, and the review found that CALHN was operating significantly above the nationally agreed efficient price for acute inpatient hospital servicing. In 2017-18, CALHN was operating 30% above the national efficient price. A massive overspend of $303 million was forecast in CALHN for the 2018-19 year, unless urgent and significant corrective action was taken. This poor performance was systemic and unsustainable. It was an extraordinary cost to the taxpayers of South Australia and not delivering the health outcomes that the constituents who we all are here to serve deserve. The diagnostic review also reported that anticipated savings from moving the new Royal Adelaide Hospital had not been achieved, and in fact costs had increased as a result of the move to the new hospital. Becoming a sustainable health network that offers quality healthcare and value for the community was the focus for CALHN when it made the bold move to enter administration in late 2018. Since late 2018, CALHN has made huge inroads towards becoming a sustainable and accountable healthcare network. The CALHN Governing Board has overseen great progress in turning CALHN around and has led the most significant period of change CALHN has ever experienced. The appointment of a new CEO and a refreshed, strengthened and highly focused executive team brought new energy and drive to this challenge. Working with Cordamentha, the CALHN leadership team set about making the change required to become a high-quality and sustainable organisation. A new clinical program structure was introduced in October 2019, and this has brought clinical and operational needs together to deliver better patient outcomes and increase collaboration and accountability. It was intentionally designed to be a collaborative, multidisciplinary solution to ensure that the patient is always at the centre of what CALHN does. CALHN also introduced new financial delegations and procurement controls to increase oversight of financial expenditure and significantly improved its clinical coding, including clearing a coding backlog to provide greater visibility of activity across CALHN. These were absolutely necessary reforms to ensure not just sustainability, but more importantly than that, better patient outcomes. Bearing the fruits of this hard work, in its first year of recovery, CALHN achieved $57 million in savings, which was $16 million ahead of its target. There has also been improvement in CALHN's national efficient price. From operating at a high of 130% of the national efficient price in 2017-18, the rate decreased to 124.9% in 2018-19 and 123% by December 2019. Improvements in the average length of stay have seen a reduction of 13.1% at the Royal Adelaide Hospital, which is linked to improved patient satisfaction, decreased risk of hospital-acquired complications, and it reflects that patients are receiving the right care in the right place. In addition, the number of patients impacted by ramping reduced by 56% in August 2020 compared to August 2019. In mid-March, when the coronavirus pandemic took full force, CALHN moved into an emergency response mode. At that time, administrators Kortamentha and the government agreed to pause the recovery program. While COVID-19 impacted CALHN's recovery, its board and executive team maintained financial controls and demonstrated the capability and capacity required to successfully manage its financial performance in a post-COVID operating environment. This built on significant improvements led by CALHN in partnership with Kortamentha in organisational processes and the implementation of a new organisational structure that has vastly improved leadership, collaboration and accountability. The associated capability uplift, along with improvements in professional governance, leadership and management protocols, has led to improved clinical outcomes and enhanced services for patients, their families and the community. Kortamentha returned in October 2020 in a consulting capacity to focus on initiatives and opportunities to assist in CALHN's evolution and to strengthen its workforce capability and flexibility. It is recognised that there is still work to do, but the means are in place for CALHN to achieve its goals. Central Adelaide Local Health Network has a clear vision to shape the future of health with world-class care and world-class research. It aims to be one of the top 5 performing health services in Australia and one of the top 50 performing health services in the world within 5 years. CALHN achieving a successful turnaround will ensure its patients receive the world-class care they expect and deserve, and that the community receives a sustainable service delivery model. So the government will not be supporting this motion.